Hello, everyone. This is Dr. Matar. I'm going to talk about a question that keeps coming my way, which is there a natural cure to the coronavirus? I'm going to give you some explanation as to why there is not a natural cure. So I don't want you to go on those websites that claim that there is a natural cure to it because there's not. Let me explain. One reason why there's not is because there has not been any valid research on natural medicines that on coronavirus. Very simple. So there's no evidence that shows that yes, let's say garlic, for example, or olive leaves or something, have an effect on coronavirus itself. We may have had some research indicating that these active ingredients, plant active ingredients, can have an effect on viral infections in general, you see. But this does not mean necessarily that it has any effect on corona. And the reason for this is easily explained by explanation. If I give you an explanation as to the difference between, say, the usual flu and cold virus as opposed to corona. They're not the same. They're not the same. They're both viruses. They both have affinity for the epithelium, which is the lining, the one cell that lines the lungs on the inside. And but they are different. The way they approach, the way they infect these cells is different. The mechanisms are different. What coronavirus has, what a virus is basically some genetic material that is encapsulated in or by a protein structure. That protein structure is extremely essential to how this infects the human cell. The protein structure is how that genetic material gets into the inside of the cell. So the protein will have to get close to the cell, in this case the cells that are lining the inside of the lungs. And when this happens, eventually the genetic material will be released into the cell, take control of the genes of the cell, and eventually cause it to die, you see? So that's how it happens. Now this mechanism is different in corona as opposed to say the flu virus or many other viruses that have current medication that can make you better if you were to be infected by these viruses. But that's not the case for corona. Otherwise, it would have been easy. If all viruses infected the cells, the human cells, the very same way, then we would already have a cure. And we may even have a natural cure, but we don't. Okay? The main reason why we don't have information as to natural cures is, and also the main reason why we don't see research going on right now in natural medicine as opposed to Western medicine, which is on overdrive, just trying to find a solution for the problem, is that natural medicine laboratories are not really equipped. They cannot really deal with the virus. They cannot get the virus into the lab and start working on it to see what works and what doesn't work. You see, they're not equipped so that the personnel don't get infected. You see, they're too primitive, if you will, as opposed to or compared to Western medicine laboratories. So we are fully dependent on medical doctors and PhDs and so forth that are looking into finding a solution for the coronavirus. Another thing that I want to also emphasize, which I get a lot of questions on, is since the flu virus is less around, less infective as we get closer to the warm season, isn't this going to be the case for the coronavirus? It may be the case, but not for sure. Let me tell you why. Number one, at the onset of this pandemic, we did not see that many cases in the warmer parts of the world. You see, like Africa and South America and so forth. Now we are seeing it. Okay? The reason why, just for you to understand those mechanisms, the reason why you would have lessening in the flu virus when it gets closer to summer is basically because we're exposed to vitamin D more because we're outdoors. We are less likely to be indoors circulating the same air and infecting and reinfecting each other. And finally, the droplets that, let's say someone is sneezing, those droplets that are made up of protein, mucus, and if you're infected, they would also have or carry the virus. Those tend to stay in the air longer during the cold season. They don't travel quickly and drop on the floor or the ground quickly. They stay in the air, potentially infecting others more often than during the warm season. And all of these things are true also for the coronavirus. However, the way the coronavirus infects, the mechanism is very distinct. It is not the same as the flu. Okay? That's why we don't have any medication for that. Western medicine, natural medicine, doesn't matter. And so what do? What we do is what the government has been asking us to do, which is social distancing. So we don't get the infection. We don't get it too soon compared to the ability of our medical system to handle number of incidents that would be infected by this. So even if everybody is going to eventually get the virus, then we want this to be slow. That's why we need to control it, you see. There's something that I want to also mention here that I have not heard much of or no reliable sources discussing this area or this issue. And I'd like you to actually send it to every single person that you know who does have high blood pressure or who may have it. Somebody who's overweight who may already have high blood pressure. The reason why is most of those that are dying of the disease also have a chronic condition. In most cases, it's high blood pressure. What is the connection? The connection is the coronavirus. Remember, we talked about the outer layer, which is protein, and the inner component, which is the genetic material. This outer layer can only attach to the cells that line the inside of your lungs through a spot, a receptor, a protein structure that is the same as the protein structure that can activate high blood pressure in the blood vessels or cause other situations in the kidneys and in the testes, in the male. Also, through similar mechanisms, this virus can also get into the central nervous system. That's why we're seeing a lot of conditions, especially in those that are severely infected and those that are showing very severe symptoms, symptoms of the central nervous system, brain symptoms, okay? So this is something that those who are on the front lines may or may not recognize, but it's becoming more of an issue. So if you have high blood pressure, get it under control now. You see? Don't have salt. Don't eat salt throughout this period. Do not eat salt. Eat a lot of vegetables, which will get your sodium. You will get your sodium, but not just the sodium. Get the sodium and the rest of the minerals. You see? So don't add salt to your food. Take weight loss seriously. Take it seriously. Most of those who are overweight also have high blood pressure. In most cases, it's not recognized or it's not diagnosed and it's not treated. Okay? So I want to make sure that this is clear. I want to make sure that this gets to everybody. We're not trying to scare everybody. We're trying to get everybody to understand what's really going on, and the fact that it may not really end in a few weeks. You see? Hopefully, if everybody respects the right of everybody else for not being infected by you. So if you stay at home, you stay, basically, you keep your distance from others, and you keep disinfecting your environment, and so forth. This is how you will delay the potential for you to get it. While doing that, make sure your blood pressure is under control, make sure you're not gaining weight, make sure you're losing weight. If you need any help of any kind, let us know. We're here at the office. We're not seeing patients, but we're here at the office. I'm available to you. I'm available to your friends and family. Free consultation for everybody. This is just a community service. It's ongoing. It's open for as much as you guys need. You and your family members and friends in California, out of California, doesn't matter, anywhere, you see. So if somebody needs help with that, with weight loss, just let us know. We can do that remotely. We are fully equipped to do everything remotely, okay? And again, my consultation is free, completely free. So do not hesitate to contact the office and get on my schedule. I may not be able to see you immediately, but or call you immediately. We're doing all of this, long distance telemedicine. But but I will get to you, okay? So definitely do that. Should you take any specific natural medication or natural supplements? Yes, take a very, very good, solid multivitamin. That's all I can tell you. Should you take vitamin C? Yes. Are there any other vitamins and minerals and natural remedies that can be helpful? Yes, there are, but none of them has been tested for corona. And I just explained to you that corona is different, you see. So, for example, vitamin C we don't have a lot of evidence, by the way, scientifically, that vitamin C is essential to prevent viral infections, but a lot of people like it and believe in it and so forth. It's okay. Take vitamin C. It can be helpful, but it may have absolutely no effect on COVID-19, you see. Don't forget that. Do not forget that. And I have made a whole list of supplements that I feel would be beneficial, but none of them has been tested on COVID-19. Should you take these? Yes, take them. Take them. Because there are so many unknowns about COVID-19, you see. So, yes, keep your distancing. Yes, take your multivitamins. Take them every day. Take them at a higher dosage. Vitamin D is extremely essential because we know it helps, but we don't know if it's going to help specifically with coronavirus, okay? So make sure everybody that you know gets to hear this message, okay? I don't want anybody to have high blood pressure that is uncontrolled. Do check your blood pressure. Check it frequently. If you are on medication already, make sure that your meds are working. If they're not, get in touch with your doctor and have them reevaluate and maybe change your meds, okay? Remember, the very same receptor in the lungs that allow coronavirus to attack the lungs and for the genetic materials to get into the lung cells is the same. That same receptor is involved in your blood pressure and your kidney function, you see? So just keep that in mind. And other places in the body, by the way, but these are the main things the main locations in the body that can potentially get affected, okay? If you still have any questions, please let me know. I'm going to try to create as many of these as possible so things are clear. And if you want me to talk about something specific, or if you hear something that you're not sure about, just send it my way, and I'll be more than happy to evaluate it and direct you to where you get correct information. Okay? Thank you so much.